Hello, I'm Dr. Simonds. I'm an obesity medicine specialist from the Triangle region of North Carolina, and this is Obesity Medicine Perspective. On our last few videos, I've been talking about the idea of getting restarted and kind of getting over your failures and getting going again. And in that regard, I want to kind of transition to some ideas that I've talked about before, which is combination drug therapy for the treatment of obesity. So a lot of people think that an appetite suppressant like phentermine, which is very popular, is the only drug out there, and that's all that we offer in the way of services. And that is not the only prescription drug that I use. I use a lot of prescription drugs to treat obesity, and I use a lot of combination therapy. Now, it's never my goal to get people on a bunch of medicine. That's not what I'm about. But if one drug like phentermine is not doing the trick, I just want to tell you that, look, there are other options available, and I can combine things. So one of the popular combinations I use is phentermine and topiramate. So topiramate is a drug that was initially approved to treat seizure disorder over 20 years ago now, and it suppresses your appetite as a side effect, and it reduces carbohydrate cravings. And it is not a stimulant like phentermine, so it actually works really well in combination with phentermine, and the FDA has approved it for short-term weight loss and for long-term weight maintenance in combination with phentermine. So we use a lot of that. We have it right here in the office. We could add it to your regimen. The key to using that drug is to start at a very low dose and to slowly and progressively increase the dose with time. It takes a little while to start working. It's not like an appetite suppressant like phentermine that suddenly works and you know an hour later that it's working. You have to actually take it for several weeks to get the effect. So it is definitely something, though, that if the phentermine by itself is not working, it is something that can help. And it helps a lot of my patients. Now, the number one problem I see in my practice is people that have overeating habits or addictive type eating behaviors when it comes to processed carbohydrates like sugar and flour. And this drug in particular seems to really help with that. So it's just an example of one drug combination that we use here, and it's not the only one. And even further medication can be added to it. So I just wanted to remind you that those sorts of things are available here, and that if you're frustrated on the current drug regimen that you're on, and you want to try something a little different, and maybe you think you need something additional, well, I want you to talk to us about that, because I think we can help you. So until the next time we talk, I'll give you the tools, you give me the effort, and together we overcome obesity.